Hi, I'm Dr. Avivit Cahn from the Hadassah Hebrew University Hospital in Israel, and I'd like to walk you through my poster presentation for the EASD of 2019. I'm presenting the efficacy and safety of dapagliflozin in the elderly population. This is a sub-analysis of the DECLARE TIMI 58 study. The study was funded by AstraZeneca, and my full disclosures are available on the EASD website. So, prior to this study, the data regarding the efficacy and safety of SGLT2 inhibitors in the elderly and the very elderly are limited. And this paucity of data has led many to recommend caution with the use of SGLT2 inhibitors in the elderly and even to restrict their use in the very elderly. Now, I assume you're all familiar with the DECLARE TIMI 58 study. In short, this study randomized patients with cardiovascular risk, either established cardiovascular disease or only risk factors for disease, to dapagliflozin or placebo. The study included a total of 17,160 patients. Nearly 8,000 were aged over 65 and over 1,000 were aged over 75. They were randomly assigned to dapagliflozin or placebo and followed for a median of 4.2 years. Just to recap on the primary outcomes of the study, we had a dual composite primary efficacy endpoint, which was cardiovascular disease and hospitalization for heart failure and major adverse cardiovascular events. We also had secondary pre-specified renal composite outcomes. We'll start reviewing the results, and we'll focus on the efficacy outcomes of the study. So let's start with the two co-primary composite outcomes. So cardiovascular disease and hospitalization for heart failure was significantly reduced with dapagliflozin in the overall study population, and we can see now that there is no heterogeneity by the age groups. We're looking at the younger population of under 65, the older population of 65 to 75, and the very elderly population, and the P for interaction for this endpoint was 0.5, meaning that the effect was consistent across all age groups. If we now move down to the MACE, we know that the MACE was safe in the overall study population with a non-significant decrease in the dapagliflozin group, and this effect is consistent across all age groups. We can now see here the components of the co-primary composite endpoints. Cardiovascular death was balanced between age groups, as was MI, stroke, and all-cause mortality. Hospitalization for heart failure was reduced with dapagliflozin versus placebo, and this effect was consistent across all age groups, although you can see a somewhat more pronounced effect in the elderly population. Down here we can see the two renal composite outcomes. The cardiorenal composite outcome includes cardiovascular death as addition to other renal outcomes, and this was significantly reduced with dapagliflozin versus placebo consistently across all age groups. The renal-specific composite outcome does not include cardiovascular death and was significantly reduced in all ages, in each and every age group, and in the overall study population. Here we can see the metabolic outcomes with dapagliflozin versus placebo. I'll remind you that this is not a metabolic efficacy study because researchers could have changed the glucose-lowering medications at any time throughout the trial to adjust and attain glycemic targets. But still we can see here in blue, dapagliflozin, right here, versus placebo in the younger patients, the blue lines, in the intermediate population, the red lines, and the green lines in the elderly patients, and we can see that dapagliflozin reduced the A1C across all age groups. This effect was somewhat attenuated here in the very elderly, green lines, at the age of over 75 at the end of the trial, but the number of patients at this time point was already not so large. And we can also see a consistent effect in weight over time. The blue lines are dapagliflozin versus placebo in the younger patients, the red line are the elderly, the green lines are the very elderly, the dotted across this whole spectrum is the dapagliflozin, the straight line is the placebo, and again we see an effect of dapagliflozin across all age groups. Now I would like to review with you the safety outcomes of dapagliflozin by age groups. I think the safety outcomes are of supreme importance in the elderly. This has been the major concern with the drug. And we do see that in this study, dapagliflozin reduced, patients who were randomized to dapagliflozin had a lower rate of serious adverse events. This was in the overall trial population with no heterogeneity by age. Major hypoglycemia was reduced. This was most significant in the elderly population, although you must note that there was no significant P for interaction value right here, but still we can see a slightly more pronounced effect in the elderly. Fractures and amputations were balanced across all age groups. Symptoms of volume depletion. Symptoms of volume depletion and acute kidney injury were major concerns with this class, because especially in the very elderly, and we can see right here that volume depletion was balanced across treatment groups between dapagliflozin and placebo. Acute kidney injury was reduced with dapagliflozin, and this effect was consistent across all age groups. And finally, DKA, as we know, is a known side effect of all SGLT2 inhibitors. It was increased in the overall study population, and we can see this increase was consistent across all age groups. But the numbers are very small. If you note over here, we had 2 versus 3 patients with dapagliflozin versus placebo. Urinary tract infections were not increased in this trial with dapagliflozin versus placebo. Should be noted that patients with over 3 UTIs were not included in this trial, and this was balanced across the overall study population, and no increase was noted in any age subgroup. Genital infections, a known risk factor with SGLT2 inhibitors, was increased with dapagliflozin versus placebo consistently in all age groups. Malignancies were balanced across all age groups. So I think overall we've seen the efficacy and safety outcomes of dapagliflozin versus placebo in the elderly and the very elderly populations. And what this trial basically shows us, what this analysis shows us, is that dapagliflozin has provided clinically relevant benefits to patients with type 2 diabetes regardless of age. So thank you all for your attention.